today I'm going to be doing the IV Infusion Checkoff. First, I'm going to check the physician's orders and gather all my equipment and supplies. I'm going to make sure I go over the 6 rights of medication administration and check the IV solution to make sure it's the proper one with the prescribed additive. I'm going to calculate the hourly infusion rate, and I'm going to, the IV flow rate is 1,200 milliliters of normal saline to be infused in 6 hours. The infusion set is calibrated for a drop factor of 15 drops per milliliter. So 6 hours times 60 is 360. And I'm going to take the 1,200 and divide by 360 and multiply by 15 to get 50. So I'm going to do 50 drops per minute. And I'm going to verify that calculation. And then I'm going to make sure I go over the infection control guidelines and the standard precautions. And I'm going to perform hand hygiene before I go into the patient's room.
Come in.
Hi, Miss Lewis. I'm Jalen. I'm your nurse. I'm coming in here to give some IV therapy. It's going to take me about 20-25 minutes to get it all set up. Is that okay?
Yes.
All right. Is it okay if I touch you?
Yes.
All right. Thank you. Can you tell me your name and date of birth?
Emily Lewis, 7/25/97.
And do you have any allergies?
No, ma'am.
All right. So I'm going to attach, if I had the pump, I would attach the IV pump to my IV pole and then plug it in to the appropriate socket. And then again, I'm going to verify the 6 rights of medication administration, and I'm going to check the expiration date and make sure it's within date. And then I'm going to check the solution for any discoloration or particles that should not be in there, and it looks good. And I'm going to place a time tape on the solution container with the prescribed infusion rate, time the infusion began, the time of completion, and my initials. I'm going to remove the primary infusion set. Oh, okay. And I'm going to go ahead and label the tubing with the date and time, and go ahead and close the clamp. All right, remove the protective cover. Okay, I'm going to get my bag out. All right, and without touching the top, because it's sterile, I'm going to spike the bag. All right, and it's clamped so nothing's coming out. I'm gonna hang it on my IV pole. Oh Lord. No good. Short. All right, so now I'm going to prime the line. So first I'm going to squeeze the reservoir, fill it up to about halfway. All right, and now I'm going to prime the tubing, make sure to get any air bubbles out, and if there were any air bubbles, I would just thump them with my finger to mobilize them. All right, now I'm going to inspect the tubing to make sure there are no air bubbles, kinks, anything. There is an air bubble, so I'm gonna. All right. All right, so at this point I would turn on the IV pump and load the tubing and to the manufacturer's instructions, and then I would program the pump for the primary infusion with the prescribed infusion rate and volume to be infused, and I would put on my procedure gloves. I will thoroughly cleanse the infusion port. Okay, so now I'm going to cleanse the IV port thoroughly. I already have my gloves on. Now I'm going to flush the line and make sure the patency of the IV line, looking for any redness or swelling at the IV site. All right, everything looks good. No patient complaint of discomfort. And now I'm going to attach my IV infusion. I made sure I checked the 6 rights of medication administration and checked the IV solution, made sure it's the proper solution with the prescribed additive. I connected the administration set to the IV catheter. I unclamp. Okay, so I've connected to my IV port and I checked my 6 rights of medication, and now I'm going to make sure that my patient's going to get the right amount of drops per minute. Okay, so now I have set my drop factor. I'm going to connect it to my pump, set my pump, and unclamp the administration tubing. I'm going to ensure that all alarms are on and audible, and make sure hourly to make sure that the correct volume is being infused. And at the end of shift, I'm going to clear the pump of the volume infused and record the volume of the I and O. Now I'm going to prepare my secondary infusion. So I'm going to check the 6 rights of medication administration and IV infusion to make sure it's the proper solution with the prescribed additive. I'm going to check the expiration date and check the solution for any discoloration or particles. So it looks fine. I'm going to place a time tape just like on my primary with the infusion rate, time the infusion began, what time it needs to end, and my initials. I'm going to get my secondary infusion set and make sure I label it with the date and time, and remove the paper. And I'm going to make sure I close the clamp. Okay, I'm going to go ahead and put my primary bag on this. All right, so I still have that. Now I'm going to go ahead and remove the cap. And remove the protective spike. I'm going to make sure that the spike remains sterile. I'm going to put the spike in the bag. All right. It's not all the way in. There we go. All right, so none's coming out yet. I'm going to make sure I hang this higher than my primary infusion. Let the reservoir fill up by squeezing it about halfway. All right, good. Now I am going to prime my secondary tubing. Make sure I cover it. All right, it came out. And make sure that the tubing, there's no air bubbles, no kinks in the line, everything looks great. If there were any bubbles, I would just thump the line to mobilize the bubbles. Okay, and now I'm going to clean the port on my primary. And I'm gonna go ahead and stop my primary infusion. All right, so now that I've cleaned my port, I'm gonna go ahead and connect. Make sure it's threaded correctly. And I'm gonna make sure the 6 racks of medication and IV administration, and the primary infusion bag is hung lower than the secondary. And I'm going to program the pump for the secondary infusion with the prescribed infusion rate and the volume to be infused. I'm going to unclamp the administration set tubing and press the start button. Ensure that all alarms are on and audible. And I'm going to check the pump hourly to make sure that the correct volume is still being infused. And at the end of shift, I'm going to clear the pump of the volume and record the volume of I and O. And then after, I'm going to document the procedure, the date and time, my name, the site location, the type and size of the catheter used for her IV, the solution that is infusing, the patient response, and any teaching that I did throughout the procedure.